Hi, my name is Domingos Oliveira, and I am the president and founder of SecuGuard. When we talk about security in Canada in 2026, we cannot ignore one of the most important environments of all, the hospital. A hospital is not just another building. It is a place where life, stress, pain, urgency, and emotion come together every single day. It is a place where people arrive frightened, families are under pressure, staff are exhausted, and situations can change in seconds. That is why hospital security must be conducted with a higher level of professionalism, judgment, discipline, and human understanding. In my view, proper hospital security begins with one principle. Security in a hospital is not only about control, it is about protection with purpose. It is about protecting patients, protecting healthcare staff, protecting visitors, protecting infrastructure, and helping preserve a safe environment where care can continue without disruption. In 2026, the hospital security officer must be far more than a visible presence. He or she must be trained to observe behavior, detect escalation early, communicate calmly, intervene professionally, and support emergency response without creating unnecessary tension. In a hospital, one wrong approach can make a difficult situation worse. One correct approach can prevent a crisis entirely. This is why de-escalation is one of the most important skills in modern hospital security. Security officers must know how to manage conflict with calm authority, how to deal with distressed individuals, how to support staff during volatile situations, and how to remain composed when emotions are high. The best hospital security is not aggressive security. It is disciplined, respectful, alert, and effective security. Another major reality in 2026 is that hospital security is now closely tied to workplace violence prevention. Security officers are part of a much larger safety culture. They are not there only to respond after an incident happens. They are there to help reduce risk before violence, intimidation, disorder, or disruption occurs. That means strong patrol awareness, access control, incident reporting, communication with staff, visitor management, and readiness to support emergency codes and critical incidents. Hospital security also requires a special mindset. In this environment, people are not always acting at their best. Some are afraid, some are confused, some may be suffering from mental health crises, trauma, intoxication, or extreme frustration. A professional security officer must understand that the mission is not simply to remove problems. The mission is to restore safety, stability, and order while respecting the dignity of the people involved. Technology is also changing the field. Today, hospital security includes surveillance systems, controlled access points, alarm systems, digital reporting, communications platforms, and stronger coordination between physical safety and operational continuity. But technology alone is not enough. Hospitals still need well-trained officers who can make sound decisions in real time, document events properly, and represent safety with professionalism. For me, proper hospital security also means partnership. Security must work in coordination with nurses, doctors, administrators, reception teams, emergency personnel, and support staff. A hospital security team should never operate in isolation. It should function as a trusted protective partner within the healthcare environment. At SecuGuard, we believe hospital security officers must be trained to a higher standard. They must combine vigilance with empathy, authority with restraint, and readiness with professionalism. In Canada in 2026, hospital security is no longer a secondary function. It is a critical part of healthcare safety. Because at the end of the day, when security is conducted properly in a hospital, it does more than protect a building. It protects care itself. It protects the people who provide it, the people who receive it, and the stability that every healthcare institution depends on. And that is exactly the kind of security culture we must continue to build for the future. Thank you very much for listening. I'm Domingos Oliveira, president and founder of SecuGuard. I appreciate your time, your attention, and your commitment to the future of the security industry in Canada. To learn more about our vision and our platform, please visit www.secuguard.org. Thank you, and I look forward to seeing you again soon.